Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Health Department plans to transfer asymptomatic patients and those with mild symptoms to quarantine facilities as hospitals continue to feel the brunt of the COVID-19 surge. Also, the government is diverting additional healthcare workers from other regions to Metro Manila hospitals overburdened with many COVID-19 patients. And a grim prediction by the OCTA Research Group, the country may reach 1 million coronavirus cases in the Philippines before the end of April. Health Undersecretary and Treatment Czar Leopoldo Vega joins us live. 1 million coronavirus cases in the Philippines before the end of April. That's the latest projection of OCTA Research. Metro Manila still yields the highest number of daily COVID-19 cases, but the group warns that cases are also rising in some regions. The so-called NCR plus bubble is now on its second week of the enhanced community quarantine, or ECQ, and the health department aims to decongest the hospitals before lifting restrictions. Let's go straight to the source of the story. We have Health Undersecretary and Treatment Czar Leopoldo Vega. Yusek Vega, welcome to the source, and thank you so much for your time.
Thank you, Pinky. Good morning to all, and thank you also for inviting me for this morning.
I want to start with this, Yusek. What is the state of hospital occupancy in NCR plus bubble now?
Well, let's have our betting on this, especially on the occupancy of all the hospitals in NCR plus. And if you take the HCUR, meaning to say that this would involve level 1, level 2, and level 3 beds, you'd have a moderate risk category in the threshold of high risk already. But if you try to look into the different big level 3 hospitals, they are on the critical risk, meaning to say there are some of them are already 85% to 90% occupied. And in certain areas in Manila, Quezon City, Taguig, Navotas, and Makati, you'd have level 3 hospitals wherein they have they are on the critical risk situation. So right now, the most of these patients admitted in these level 3 hospitals do occupy a number of beds, since the total number of beds that we have allocated for COVID here in Metro Manila to cover level 1 to level 3 is about 8,000 plus, Pinky.
So when you talk about level 3 hospitals, just for clarification, you're referring to the big hospitals.
Yeah, level 3 hospitals, these are hospitals that are capable of handling critical cases like with ICU setups, with operating rooms, and several diagnostics. So these are the level 3 medical centers. So we have say in private, we have the St. Luke's Makati Med, and of course Medical City. And in comparison with the government, you have East Avenue, we have Jose Rodriguez, we have Jose Reyes. So these are the level 3 hospitals capable of handling severe and critical cases with enough diagnostic and surgical capacity.
And you say right now they are at critical level, these level 3 hospitals.
Right. If we took a notice in our data, most of this occupancy of, especially with the hospitals, level 1 and level 2 still admit at mild and asymptomatic patients. And even level 3 hospitals, they do have some mild and symptomatic patients. And our data shows that 41% of admissions in all levels, they admit about 41% of all these mild and asymptomatic cases. And that's actually the problem here and the challenge, because we need to decongest these hospitals and leave the hospitals specifically for moderate and critical cases. And this is the reason why we've been tasking the different local government units through their op centers, and also the level 1 hospitals, private ones, to make sure that they do admit the moderate cases only and leave the mild and asymptomatic to the temporary treatment facility. So roughly, if I have in NCR about 4,000 new cases a day, then I would have roughly, since 90% of this or more would be mild and asymptomatic, that's roughly about 3,000 of them. And if 41% or 1,000 on a daily basis actually converge to the hospitals for consult and admissions, then I would have problems, since the turnaround time for a patient staying in the hospital, even if you're mild and even asymptomatic, you'd stay there for 10 to 14 days. So
That's right.
That long turnaround time makes it very hard for the hospital to operate efficiently. And it in 1 week, if I have 1,000 plus coming in, mild and asymptomatic, seeking admission, then I really have good problems, since I only have about 8,000 beds in the NCR for this kind of cases.
It's good you brought that up. So the level 3 hospitals are at critical level. So what percentage would that be when we talk about level 3 hospitals? What is the occupancy?
Yes. Yeah, the level 3 hospitals are really in a high risk and critical risk position. In other words, patients really would seek, and this is the health seeking behavior of most of us, that they have more confidence in the level of the hospitals, which can be a one-stop shop. In other words, full diagnostics and full clinical setups. And and this is the reason why most of the patients do converge towards the bigger and level 3 hospitals. And we do have only a few big level 3 hospitals in the metropolis, both public and private. So that's one of the reasons why they actually have a lot of this high volume capacity in the emergency room, and even in the in the critical areas like ICUs.
So in the level 3 hospitals, Undersecretary, at critical level, are there still hospital beds available in these level 3 hospitals?
Some of them do, but there are level 3 hospitals that are really on the high risk and critical area. So not enough really to spare if there are more coming in, especially if, say, 4,000 of new cases and 2% of this are moderate and severe. That's 2% of 4,000 is roughly 80. And every year, if there are 80 patients coming into the institution as moderate and severe, and I have a long turnaround time for my ICU, because patients do stay in the ICU more than even 14 days. They can go more than 30 days. Then it actually overcrowds and actually makes the occupancy a big challenge in terms of making sure that this kind of patients are accepted to these level 3 hospitals.
Very good that you pointed that out, Undersecretary, because that's the same number I'm looking at. If we have an average right now of about 4,000 cases in NCR, and 0.6 and 0.6, or let's just put it at 1%, are critical and severe. At 4,000, well, more or less, that would be 40 patients 40, in NCR. Yeah, 40, but 40, that is 40, yes, those are 40 patients, severe and critical, every single day. So I'm wondering, Undersecretary, where should these 40 severe and critical on a daily basis, beginning today, tomorrow, and the whole week go, now that it seems wala na ho silang ospital na mapuntahan?
Right, Pinky, I'd like to inform you also that it's not only the 2% or the 1% that you're dealing here, which is positive for COVID, but you also have to deal with the probable and the suspects with also with symptoms but negative for COVID. And this actually ramps up the occupancy of the intensive care unit, because I have only about 600 plus or 82 intensive care units in the metropolis allocated for COVID. In other words, if I have at least 2% or 80 people coming in needing specialty care like an ICU, then it really is a problem, especially of the higher turnaround. So what we are trying to say now is that the hospitals must try to allocate more beds for the intensive care. But there's in other words, those intensive care units, the beds are there, but they're being used for non-COVID. and and the and what is happening is that the non-COVID beds has to be maintained. But if you want to increase the number of COVID beds, especially for ICU, and allocate more beds, then there's a trade-off. The trade-off would mean that I will have to suspend most of this emergency surgical and medical that are non-COVID. So that's the kind of balance that we have to do, especially in a clinical setting, wherein you make sure that the COVID are well covered and the non-COVID are also non-covered. Otherwise, you will have the morbidity and the mortality will increase if we do not find this kind of balance.
I understand that completely, no, Undersecretary. We're not just talking about COVID patients right now. There are other illnesses that need emergency care. However, I will go back to my earlier question. What happens to those 40 critical and severe? Hindi ko na nga po sinasama yung moderate eh. Critical and severe, 40 of them every day. Where can they go?
They can still be accommodated because in the past few weeks, there are still areas in the in Metro Manila or even in the NCR Plus where hospitals with an ICU setting can accommodate because some of these patients, especially in the ICU, admitted 2 weeks ago, can have been discharged, no, and there is a vacancy for that. So we make sure that we can coordinate this kind of transfer to the different ICU settings, but it's really a challenge because to find the vacancy here because especially in Metro Manila, wherein there is a need really for expansion of the intensive care unit. And some of the hospitals like Lung Center of the Philippines has already expanded the intensive care unit. In other words, ICU settings in private and isolated rooms wherein these patients can be given adequate care it's as if they're in an ICU, but they're in a private room. So in other words, so we have to move it and expand the different areas in the hospital. They do have some beds, but what is very challenging to help sustain this hospital, Pinky, is their financial sustainability, especially with the hospitals catering to severe and moderate cases. You know, it needs sustainability in terms of finances, and they've been asking a lot of reimbursements coming from PhilHealth because this is really one way of giving them the capital resources that they need, especially in this pandemic, wherein you need to adjust human resource, you have to adjust equipment, and you need to adjust in terms of space and providing more for moderate and severe cases.
Okay, so let me go back to this, sir. What is the marching order now, knowing that we will have about 4,000 more or less cases a day? 40 of them will be severe and critical. Are you telling now the hospitals, please remove the mild and asymptomatic? Is that already an order from the One Hospital Command to free up the rooms and bring in the moderate, severe, and critical?
Right, Pinky. I think we have to look at it at the perspective that we should come up with an integrated system or network with the LGU. In other words, what we're saying here now is that through the op centers of the LGU, they are able to sort out or triage patients because they know the community and they have the inventory for assets, no, for healthcare. They have the doctors and the infirmaries and the clinics and the level 1 hospitals. So in other words, they have to act as a pre-hospital triage and make sure that not all patients with mild and asymptomatic will go towards the emergency room of several level 3 or level 2 hospitals. So in other words, if I have a pre-hospital based triaging, sort this out and make sure that only the moderate and severe can actually be admitted for care in hospitals, then I think that should actually decompress the hospitals because 41%, as I was saying, of mild and asymptomatics are admitted.
Okay, hold that thought, Undersecretary, because yes, the LGU is planning to open a triage. Undersecretary Vergere was saying that this is a way for the LGUs to help the hospitals to be able to somehow decongest them. We need to talk about this and more more issues after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, treatment czar Leopoldo Vega. Undersecretary, before we go to the triage, which could really help, is there an order? Let me reiterate my question a while ago. To hospitals who are caring for asymptomatic and mild patients to help them find a way, siguro, to go to other hospitals, maybe level 1, or even stay home if they will be able to do some sort of home care. Meron na ho bang ganong klaseng utos?
Yes, Pinky. I think there's a department order to that effect that for mild asymptomatic cases, they could be managed by the LGU or managed by as a step-down facility by the level 3 hospitals. And one of this example of this is a very good step-down care of Rizal Medical Center and of course Tondo Medical Center, wherein the step-down care of Tondo Medical Center for this surge is in PICC, and that's they operate a portion of PICC, about 50 beds, and that's where they step down to make sure that they have the adequate or decongest the hospitals. So in totality, with the presence of the local government unit, and of course with an integrated system now working out with the one hospital command, we are well aware of the importance of virtual telemedicine, and we have to fast track telemedicine consult, especially through the local government units or in the different level 3 hospitals, or even in the one hospital command. And this can actually bring down the anxiety and the passion for moving towards hospital at once because they are positive for COVID. So in that way, with the technology that we need, especially in telemedicine consult, with the opening up of more isolation hotels and facilities by the local government unit, and especially in NCR through MMDA, Oplan Kalinga, I think we can gain the confidence of these patients to stay in their homes or even in the isolation facilities if there is actually the local government health personnel that are there, or the personnel of the hospital institutions that are there to supervise and manage them. So we need to have that kind of confidence in allaying the fears of the mild and asymptomatic.
Just very quickly, Undersecretary, what if the patient who's already in a level 3 hospital refuses to leave because that patient feels he or she will get better care in the hospital rather than staying in a level 1 hospital or at home, even with telemedicine?
That's right, Pinky. This is the health-seeking behavior of most of us. We tend to gravitate towards a center which is a one-stop shop. We know that I can easily get the diagnostics or the clinical management because I'm there, and they refuse to leave because of that kind of confidence that they have, even if they will stay in queue for a longer time. But what we're saying is that we have to assure the public and those with mild and asymptomatics that they can be, if you have a single room and you don't have any persons with you who are with high risk in terms or vulnerables in terms of COVID, then you can easily have an oxygen oximeter, pulse oximeter, a temperature, and you can actually manage yourself. And through the teleconsult or even phone referrals or medical directions by the one hospital command, or even with the local government unit. So we have to assure them that even if they are in the isolation centers, the presence of the medical staff and presence of certain if these people get sick enough that they will be at least be sent over to a hospital at once. So
Okay.
this kind of confidence that we really have to build and make sure that the isolation and quarantine facilities are well staffed and they
Okay.
have the necessary ambulances.
Undersecretary, I just want to bring this. I hope we can show it on air, the graph from the Department of Health. This is always being talked about, even amongst my friends. When you look at the April 5 data, it says ICU at 79% occupancy, isolation at 72% occupancy, ward beds at 60% occupancy. So that was last April 5. The question is, if I ask you now, Yusek, meron
Mhm.
pong severe at critical ngayon that needs to go to a hospital. Please tell us, where can that person go today?
All right. This figures actually shows the general HUR capacity of level 1, level 2, and level 3. So generally, it's when you say ward beds and the isolation wards, it's generally on all levels. But the ICU beds at 79%, it only means that there are ICUs in the level 3 which still are unoccupied, and there are still government or facilities or even private facilities that can accommodate. But the caveat here is that there has to be a real time data on ground. So what we
Mm-mm.
see is the dashboard. Say if we see this in the dashboard in the One Hospital Command, we think of this as already on real time. And our challenge here is that we need to make sure that the operators or the data managers of the different hospitals must be able to register or encode on real time the data that they have in the different settings, because
Yeah.
this will be our judgment in terms of how many occupancies or vacancies that you have. So we need a certain upgrade of platforms, especially
Mm-mm.
when we talk of occupancy and vacancies on real time.
Yeah. So you are saying, obviously, that this data is not real time, because that is the suggestion from some sectors. This needs to be real time. Eh?
Yeah, right. That's not real time. Sometimes there are institutions that would fail to put in the necessary registry of data or encoding, and it would be delayed. And our calls coming from the One Hospital Command means that we will actively depend on what our dashboards actually will state, and that basically sometimes there is a mismatch between our dashboards and the presence on the present situation on the
Okay.
ground because of the non-real-time data that are being pushed.
So, Yusek again, where can COVID-19 patients go now? Saang ER ho sila pwede pumunta sa NCR? Could you tell
Uh,
us?
yes, for the main government institutions, we have big ones. And for the emergency room, I think the biggest emergency room for COVID referral is basically in Quirino Memorial Medical Center. They have a 50-bed or a 70-bed emergency room. That's the biggest. The private institutions for the ER, if they have more than 50 to 20 beds, they're full. The other big emergency rooms is in East Avenue. That's where they can actually they just opened up the old emergency room together with the new one, and this can also accommodate roughly about 50 to 70 ER patients to cover the moderate and severe. And lastly, we have the main COVID referral center in Jose Rodriguez Memorial Hospital. That's in Tala, and that's purely COVID. And I think as of this date, there are about 10 ICU patients in a space of about 20. So that kind of vacancy can actually be pushed. But sometimes when you move patients, especially on a private level to a government trained hospital, there is some hesitancy in terms of moving towards
Yeah,
that direction, and that kind
that's
of
right.
sometimes gives a problem.
Yusek, I just want to bring in what we've been hearing and seeing on social media. Even our reporter, Tristan Nadalo, had a report saying that some go all the way to Dagupan to find the hospital. In fact, the doctor at the Dagupan Doctors Memorial said they've been receiving requests from patients in Manila to take them in. There was another report. I think his name is Leirel Fontao, so I hope I pronounced it right. He said he called 48 hospitals in Metro Manila, found none to accept his friend. After 3 days, they found a hospital in Rizal. And this one, a 66-year-old woman who had low oxygen level, was treated inside her car outside the ER of a private hospital in Dasmariñas, Cavite. What kind of other siguro solutions are you looking at so that we don't hear these kinds of stories from people scrambling to find hospitals to be able to take patients in? Go ahead, you say.
Very true, Pinky. Even with the experience, very true, Pinky. Even with our experience in the One Hospital Command, we had been coordinating and referring patients that would need, especially moderate and severe, that cannot be accommodated, especially now in Metro Manila. We look for a space for them to the One Hospital Command in the region, in Region 3 and Region 4. And we've also noticed that there's a spike in those areas, especially in the private institutions and even in the public. And we make sure that these patients who do have coordinated care. In fact, there are now patients that we have been sending over to Nueva Ecija through our referral system. And this is through Paulino Garcia. And we have also asked the government retained hospital in Pampanga, that's Jose Bilingad, to actually accommodate more and open up at least more than 50 to 60% of this. But the challenge really is we need to have more infrastructure in terms of this kind of pandemic, wherein the institutions or the big level institutions, even the public and the private, are choked in terms, especially with the emergency room and the ICU, in terms of the volume. So the only consideration that we're also thinking of, and we have thought of this even last year, was to come up with a field hospitals. And it became a reality for Tala, wherein they were able to come up with a field modular hospital that can cater to moderate and severe. And then we're going to come up with and open up the 110 in QI. This is the field modular hospital in and with an ICU setting. So we have to move towards infrastructure. More of this, we have to move towards human resource, and we have to move to make sure that PhilHealth also gives us the backing in terms of our financial resources.
Yusek, very quickly, I have a minute left. What is your reaction to the appeal from the Philippine College of Physicians? I-transform daw yung ibang mga hotel into a health facility. Are you considering doing this soon?
Yeah, right. That's for especially for mild and asymptomatic, or even moderate that are controlled. You can have a virtual consult. And this can be allied with a big institution like a level 3 institution, and this can be accredited, and they can do that, and for mild and asymptomatics, or even with controlled moderate cases, especially with controlled morbidities. So I think that's a big idea that can lessen up the impact on the health system capacity.
Will you ask the president, because I know that they wrote the president about this already, will you urge the president to somehow implement this, to order this?
Yes, I've asked, requested this to the Secretary of Health. Now we need to come up with something like a home care, something like wherein the patients are in the hotels, and they can have easy consult with their physicians, as long as these are reimbursed and PhilHealth accredited, so that it will have also incentivize the private and the public hospitals.
Undersecretary Leopoldo Vega, sir, maraming salamat po sa inyong oras.
Maraming salamat, Pinky. Thank you.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.